Swadee Krap and good afternoon. Sunday, the 18th of April 2021 today. So firstly, thank you to Dr. Tui Sin for giving us the briefing in the Thai version just now. Of course, today is the first day that the new measures are being implemented. Today is Sunday, the 18th of April 2021, according to the new measures that had been agreed by the CCSA general meeting that we had reported to you the past days, as well as it has been published in the Royal Gazette already, so it is official and it will be implemented accordingly. So Dr. Tui Sin firstly talked about the current situation. One issue he mentioned is about the field hospitals, which of course is an ongoing management task for the CCSA right now. There are a number of beds in the various field hospitals, and there had been a lot of issues that we had to solve. But nevertheless, of course, the patients in there are being taken good care of according to the standards. One good point is that they won't be lonely while being in quarantine in the field hospitals because of the other patients being there as well. So we hope to keep up the good standards and improve as we go along and to address the situation that we have right now. Another information that is in the news is, of course, the Civil Aviation Authority of Thailand, or CAAT, had announced that domestic flights would not be allowed to land or operate between the times of 2300 hours to 0400 hours, or 11 p.m. to 4 a.m. in the morning, which is the period of time that the CCSA has asked for the cooperation of people to minimize or limit movement and travel. So accordingly, that will be applied to domestic flights as well. So firstly, the general situation that we have for today and the numbers that we have for you. We have recorded for you new confirmed cases, 1,767 new cases, with new recoveries being 113. So as you can see, the number of new cases far exceeds the number of recoveries that we have. The 1,767 cases that we have for today, 288 of that number is from active case finding. The total number of cases still being treated at the moment, and you see that on screen, is 13,568. We hope that this number will not be increasing in the coming days and weeks. If you recall, the past months, the number of active cases still being treated was much lower in the thousands, in the early thousands, rather than over 13,000 that we have for today. We have 2 new fatalities recorded for today, making the cumulative number of fatalities since the very beginning in Thailand at 101. So just some observations from the new cases. More infected cases are continuously being detected with serious symptoms. The clusters are also being reported in state agencies, state offices as well, and private companies and educational institutions. Local transmission has occurred basically because the DMHTT measures have not been practiced. It has been practiced less than expected, a bit lax, so we hope that this will be beefed up by everyone. At the same time, several infected individuals did not make self-evaluation of their infection risk, and therefore they did not conduct any test or did not seek any medical attention. The cases reported today were detected in hospitals and healthcare facilities. Most were found in Bangkok. Authorities are providing the screening as extensively as possible. And yesterday, the Ministry of Labor, in collaboration with the Public Health Ministry, set up in the Bangkok Youth Center in Din Dang District a testing center for COVID screening. Now, this center can accommodate up to 3,000 people per day for free under the Social Security program. On disease control measures, just to recap from yesterday, the infographic shows a summary of the latest restrictions to contain the recent wave of COVID, which are effective from today for at least 2 weeks. And all 77 provinces were divided into two categories of zones, the red zone and the orange zone. Bangkok and 17 other provinces are in the red zone, while the remaining 59 provinces are in the orange zone. So we'd like to ask for your kind cooperation, everyone's cooperation, to work from home at the maximum capacity. Working from home at the maximum capacity to minimize risk, and unnecessary travel is also not recommended to travel during this time. In Bangkok in particular, just one interesting piece of information is that the Bangkok Metropolitan Administration, or BMA, the spokesperson of the BMA had revealed that hospitals in Bangkok have a combined capacity of treating 9,183 patients. Currently, up to 4,939 patients are being treated, and patients who have none or no or mild symptoms would be transferred to the hospitals or hotels that have been converted into treatment facilities to reduce overcrowding in hospitals. The BMA has also announced that it will provide special waste bins for face masks, together with red waste disposal bags at around 1,000 spots in designated public places in Bangkok. And you see some images up there on screen. They have urged the public to properly and correctly dispose of used face masks and avoid mixing them with general household waste to prevent the spread of COVID. Some provinces around the country have also introduced additional measures for people traveling to their provinces, such as, just some examples, Krabi and Chiang Rai. So in Krabi, starting from today, travelers from red zone areas need the COVID test results conducted within 72 hours or a vaccine certificate certifying that travelers have completed 2 doses of vaccines to enter the province of Krabi. In Chiang Rai, the governor of Chiang Rai has signed an order seeking for the cooperation from members of the general public to stay at home as much as possible for the next 14 days and wear masks, especially in public areas. Now, there's a pending concern over the number of rooms in hospitals, the shortage of hospital beds, as you may have read in the news. And the government is well aware of this concern over the hospital bed shortage due to the spike in the caseloads. And as a result, the government has ordered authorities to provide up to 25,000 extra beds nationwide, in addition to the capacity of the normal situation. Authorities are also developing hospitals and field hospitals to increase beds for patients. So as I mentioned, it's an ongoing task of management. And we hope that it will turn out very well and be able to address the needs of Thailand currently. Update on the rollout of the vaccination, as mentioned by Dr. Tuisin. As of the 16th of April, 586,032 people have been vaccinated since the end of February so far. So just additional points before I end for today. So I want to recommend that members of the public remain vigilant by continuing to observe DMH-TT. There's a ending slide that I'll have for you is on what to do when a person is found to be infected with COVID. And this was reflected in the briefing of Dr. Tuisin just now as well. So as you can see on screen, we have some recommendations of what to do when found infected. Firstly, prepare your own documents. Of course, it's obvious, such as IDs and the COVID test results, if you have that. Do not leave your accommodation or travel across provinces. Wear a mask and isolate yourself from family members. Do not share personal belongings or personal utensils. And contact the hotlines that are available on screen, such as 1330, hotline 1668, hotline 1669 to seek medical attention and care. And if tested to be positive, of course, the medical personnel will be advising you to go into the quarantine system and with the other requirements as well. And this infographic we showed just now is courtesy of the credit to the Public Relations Department. Thank you very much. So this is all I have for you for today. Please enjoy the rest of Sunday. Have a safe and pleasant rest of the week, and we'll see you again tomorrow. สวัสดีครับ
ครับขอบพระคุณนะครับท่านณัฐภานุนพคุณนะครับรองอธิบดีกรมสารนิเทศและรองโฆษกกระทรวงการต่างประเทศนะครับและทั้งหมดคือการแถลงข่าวจากสบคประจำวันนี้นะครับคุณผู้ชมสามารถติดตามการแถลงข่าวจากสบคได้เป็นประจำทุกวันนะครับ 11:30 น.รวมทั้งในช่วงบ่ายจะมีการลงรายละเอียดนะครับจากทางกระทรวงสาธารณสุขก็สามารถติดตามกันได้อย่างต่อเนื่องนะครับตอนนี้หมดหน้าที่ของผมแล้วครับสุขนาริศมนตรีพร้อมทีมงานทั้งหมดลาไปก่อนนะครับสวัสดีครับ